I believe so.
Okay.
Fingers crossed, at least.
Okay, very good. Hi, everybody. I want to introduce myself. I'm Andrea Heyman. I'm one of the nutritionists at Kennedy Krieger. Today, I'm joining you with the Family Health Forum, and this presentation is really to focus on diabetes management. Um, Again, my name is Andrea Heyman. I'm a dietitian nutritionist at Kennedy Krieger Institute in Baltimore. I've worked here at Kennedy for about 12 years, and my focus is on weight management for individuals with a variety of disabilities. Um, and with that, I work with many patients who have prediabetes and diabetes. And so today I want to share with you sort of the best practice of treating individuals with diabetes. And to that end, definitely with a focus on nutrition strategies. So the goal of the Family Health Forums is really to help kind of focus on the whole family and help reduce health disparities for people with a variety of disabilities. And in order to do this, we want to support the entire family. Um, Everyone does better when the people around them, their family members, and the people living in their households are supportive and doing the same healthy practices together. Um, and I just feel like, that all the more people that can benefit from healthy practices and healthy habits and all of that. All right, so the forums are super important because health in general has an impact on the quality of life for people with intellectual disabilities and their families. And recent data from Special Olympics athletes helps us understand this even better. We know that Special Olympics adult athletes are 2 times more likely to be obese compared to adults without intellectual disabilities. And I'll go through some additional statistics and prevalence data as it relates to individuals with diabetes in a little bit. And individuals with intellectual disabilities have as many chronic health conditions at 20 years of age as the general population does at 50 years of age. And that's really important because we know that these chronic health conditions sort of are progressive and they take a long time to develop, but they also worsen as people age. And so we want to address that earlier in the age so that the conditions don't become more debilitating. And we would just want to remember that health in general affects how well athletes train and compete, and in general, live their daily lives. So today I'm going to provide an overview of diabetes management, focusing particularly on the nutrition aspects of management. And I'll also briefly discuss common medication treatments for diabetes and strategies to help track your blood sugar. So there are a few types of diabetes. The most common are type 1 and type 2, which I'll just give a quick comparison here. So type 1 diabetes happens because your body is no longer able to produce insulin. This usually happens or often is discovered during childhood, and it's something that is kind of a condition for someone's entire life. When you compare that to type 2 diabetes, your body still produces insulin, but it doesn't make enough of it, or it doesn't use it efficiently. And type 2 diabetes can develop at any age, but most common in adults over middle age, like over 45. But we're beginning to see type 2 diabetes as one of these chronic, very common chronic health conditions that does occur, starting sometimes in the teens and 20s. Um, Certainly a risk factor for developing type 1 diabetes is having a family history. That's also true for type 2 diabetes, but more of a risk factor, I would say, is if you are overweight and or obese and just have general kind of not great healthy lifestyle habits. So some symptoms are like over urination, increased thirst or appetite. For both types, these symptoms are very similar. And also people can experience some unexplained weight loss when they are first developing diabetes. There's really no prevention, no known prevention for type 1 diabetes. But for type 2 diabetes, we really want to focus on healthy lifestyle interventions, whether it's exercise, um, healthy eating habits, maintaining a healthy weight, all of that. And for treatment, type 1 will use insulin injections for the most part. And for type 2, and that makes sense for type 1 because those individuals don't make their own insulin, so they need a source of insulin. And type 2 diabetes, again, the healthy lifestyle, and then there are other medications that can help with management as well. So I'm going to kind of move toward type 2 diabetes a little more in depth, since that really is the most common type. And that's probably mostly what we're going to talk about in this presentation. And here you can see that there are a lot of a pretty complicated physiologic process that causes diabetes. And one of the pieces is that obesity and extra adiposity, especially visceral fat. Visceral fat is the fat that is found in the torso, that's kind of lining and stored around the various organs, whether it's the pancreas, the stomach, all of those organs that are in the abdomen. And that fat really drives inflammation and kind of causes some metabolic disruption that prevents insulin from working properly. Insulin is what is needed to help uptake and utilize carbohydrates in our body efficiently. We can also see some mitochondrial dysfunction, and which also leads to that chronic inflammatory state that we know really interferes with normal glucose metabolism. And glucose is kind of like the building block of energy that we get from our food. So you can see from the diagram there, so you can see the fellow sitting at the desk in the chair, he's feeling very tired and hungry. So what happens? People then respond by eating some food. The body's response then is to release insulin, make and release insulin in the body to help uptake that food for energy. If the receptors are not, I guess receptive is the best word, and that will prevent that insulin from being effective. So that results in sugar that's kind of left in the body, stored as fat. And we just talked about how those fat those fat stores are the ones that are very inflammatory and are driving kind of this circular system that we call insulin resistance. And it's that insulin resistance when your body is not using the insulin properly that results in type 2 diabetes. We know that there are a ton of systems in the body that are affected by diabetes. So it is a very complicated condition and can wreak havoc on a lot of different systems. So first of all, there are microvascular complications such as retinopathy, which is like an eye disease, that if you have high blood sugar, It can damage the blood vessels in the eye, in the retina, and that can cause risk for vision impairment or blindness. Another type of microvascular complication has to do with the kidneys, and we call that diabetic nephropathy. And high blood sugar levels can damage the kidneys, like the way that the kidneys like filter the filtering systems, and it can cause chronic kidney disease and potentially kidney failure. And then finally, nerve damage. Nerve damage is like a lot of individuals with not well controlled diabetes can report that they have like numbness in their fingertips and kind of pain or a loss of sensation. And then individuals with diabetes also have very, very high rates of coronary artery disease, heart attack, and stroke. And approximately 1/3 of adults with type 2 diabetes have some kind of cardiovascular risk. And then we also see damage to arteries. So we'll see reduced blood flow to limbs, which can increase the risk of wounds like bed sores, pressure sores, or infections, and then lead to amputations. And there's hospitalization data that shows that a substantial number of lower extremity amputations are because of diabetes. And then just in general, I would say that it is because of all these kind of side effects or things that diabetes can cause, it can really result in significantly decreased quality of life. And because of that, because diabetes causes so many complications, it's important to have strategies to manage diabetes so that we can keep these complications at bay. We don't want them. Nobody wants them. All right. So how common is diabetes? So we do see that individuals with developmental or intellectual disabilities have higher rates of diabetes than those without disabilities. And based on data from the Centers for Disease Control in 2025, showed that the prevalence of diabetes prevalence is significantly higher among adults with disabilities. So we can say that in adults without a disability, about 5.8% have diabetes. In adults with a milder disability, 9.5% have diabetes. And then if we're talking more of a severe disability, 18.3% have diabetes. So you can see as the condition becomes more significant, the rate of diabetes increases vastly. And we're also seeing that there's an increased risk of diabetes onset earlier in age. And just in general, overall, such significant risks that are developing much, much earlier in life and more more severe risks as well. All right, so my focus as a nutritionist, I am always, obviously focusing on lifestyle interventions, particularly nutrition and eating habits, to help individuals live their healthiest, best life. And nutrition can critically influence diabetes management and can affect insulin sensitivity and blood sugar or blood glucose control. Physical activity, meal timing, and stress management, they all work with nutrition to optimize diabetes as well. We're going to go into a little bit more detail in a bit, but I just wanted to mention that the American Diabetes Association identifies a Mediterranean style of eating and low carbohydrate eating patterns as having the strongest evidence for improving glycemic control, glucose blood sugar control, and preventing or delaying type 2 diabetes in individuals that are at higher risk for developing diabetes. I always think, I mean, when I have my nutrition brain on, I'm always giving nutrition guidance to emphasize that we're ensuring everybody has adequate nutrition. And we want to think of key general nutrition principles. And those can also include getting a variety of food. So a variety within each food group. Let's take the fruit food group, for example. It's great if you eat only apples and oranges, but even better is if you get a wider variety of fruits from that food group, whether it's mango, pineapple, kiwi, grapes, strawberries. There's so many, and we get different nutrients from different options. So variety is super key. We want to remember that when we're talking about our grains food group, and when I refer to that, what I mean is cereals, breads, rice, pasta, tortillas, English muffins, crackers, things of that nature. Our grains, half of those that we eat should be whole grains, actually half or more, but at minimum half. And when I say a whole grain, those are going to be typically your whole wheat options or like the brown rice. That's because we're getting a lot more nutrients. So what happens is in a whole grain option, the manufacturers are using the entire grain but if you think about, let's say, like a white bread, they have taken from the flour, they've taken off the outer layer, which is the healthiest, and that's where the most nutrition lies. And they've taken off that layer, and which is no longer used in the manufacturing of that food item. So we want whole grain items for sure. Definitely want to encourage more fruits and vegetables. And in general, we want a goal of eating at least half of our food from fruits and vegetables. Most people don't do that. I talk to people all the time, and that is something that we are working towards. Eating at least half of the foods that we're taking in are from fruits and vegetables. A really beautiful habit to kind of adopt is to have the whole family involved in meal preparation and cooking, whether it is meal planning, grocery shopping, preparing, chopping, cooking together. Everyone can have a role. Again, we want to encourage balance. So we don't just want to eat all vegetables all day. We want to have vegetables, fruits, protein, dairy, grains. We want foods from all of our 5 basic food groups. And I always want to encourage folks that there are ways that cost doesn't have to be a barrier. There are a lot of resources available to help decrease cost and strategies to help make healthy eating very affordable. All right, so let's start to get into the nitty-gritty here. So the role of nutrition in diabetes management. Overall, when I'm working with someone who has diabetes, I am trying to help maintain their blood sugar levels. And that is really done by kind of monitoring or providing guidance on carbohydrate management. Typically, when we talk about carbohydrates, people are going to think about grains, pretzels, cereals, pasta, rice, all of those kind of common foods that we think of when we think of carbs and carbohydrates. But carbohydrates can also come from fruit. They're present in vegetables and present in dairy. Carbohydrates are really what affect our blood sugar levels more than any other component from food. So it's critical to be mindful of how much carbohydrate is consumed, what type of carbohydrate is consumed at what time at a time. So again, those carbohydrates are what really impact our blood sugar levels for diabetes. So things that have more added sugar, those are going to be our obvious sources that cause very rapid increases in our blood sugar. So things like soda or candy or cakes, pies that have a lot of sugar in them. We want to also have a balance from our different macronutrients. So we have three macronutrients. One is carbohydrates, which we just talked about, but also proteins and fats. And including proteins and healthy fats in meals helps moderate any blood sugar fluctuations and also helps us feel full longer. It's also really important to focus on meal timing. If we are consistent with spacing our meals out and similarly not going too long between eating a meal, that can help prevent blood sugars from going too high, but also prevent them from going too low throughout the day. All right, so simple carbohydrates, those are the ones that I just mentioned that are often simple sugars that have that take the body the quickest time to digest. And that those are the ones that are going to have the quickest impact, causing a rise or spike in our blood sugar levels. Again, those are going to be things like candy, soda, cookies, things of that nature. Also, really more refined foods, if it's more processed food like chips or things of that nature, that's not necessarily found in nature. It's not naturally found that way, but is more processed and comes to the supermarket as a processed foods. Those are the foods that are going to affect our blood sugar levels more by increasing them more. Now, we can have more complex carbohydrate sources coming from fruits, vegetables, and whole grains. Those are very rich in dietary fiber, and we know that fiber helps slow glucose or absorption. So that helps our blood sugar stay at an even level over time after we eat, after a meal. And some folks will use carbohydrate counting tools. I'm not going to go into it so much in depth today because that's a whole process of learning. But certainly if this is a strategy that you want to utilize to manage your diabetes, any dietitian can help with that. But basically what it is at kind of trying to keep the amount of carbohydrates that you eat at any one time very consistent from day to day and meal to meal. So for example, someone might say that they aim to have 45 grams of carbohydrate at lunch every day. And they have learned which foods have carbohydrates and how much so that they can maintain that goal that they're shooting for. And again, we want to balance our carbohydrates with proteins and fats as well to help stabilize that blood sugar and reduce the blood sugar spikes that can occur after meals. All right, again, dietary fiber is so critical for many, many reasons, but today we are focusing on diabetes management. So we know that dietary fiber slows carbohydrate absorption. It releases the glucose from the food over time, a longer period of time. Also improves cholesterol and supports digestion. So a whole ton of benefits from dietary fiber. Whole grains are those, again, that are kind of the whole wheat version, which in this picture, you can see in that bread in that back right corner. Those are going to be better for helping us provide steady blood sugar and limiting glucose spikes again. Legumes are great. Any kind of bean or lentil are fantastic to help maintain blood sugar. Part of that reason is because they are so chock full of dietary fiber. Again, protein and healthy fat. Protein helps slow digestion. So that means that you're gonna kind of eating carbohydrate foods with some protein foods is going to help stabilize blood sugar when it is paired with carbohydrate. And healthy fats such as coming from fish or coming from eggs or olive oil or canola oil, those are going to be better suited, and they can help improve insulin sensitivity and cardiovascular health, which overall ensures that our glucose levels are in good control. And again, going back to our balanced meals and ensuring that at each meal we want to have consistent amounts, healthy amounts of food. Larger meals obviously are going to give a bigger load of glucose at any one time. And that we want to limit that. Okay, again, some other tips. I think it's super important to think about meal timing of meals. I alluded to this before. I encourage people to be consistent and eat every 3 to 5 hours, whether that's a meal, or some people even split that into shorter amount of times, maybe every 3 hours, but you're having much smaller meals and snacks throughout the day. Eating this style, and being consistent with when you are having your meals absolutely helps with diabetes management. Water is super, super important. People talk about hydration, and when I say hydration, I'm only thinking of water. I'm not thinking of other drinks. Even 100% juices, iced tea, lemonades that are sweetened, soda, obviously, all can have like a significant impact on our blood sugar levels. And then when I work with folks one-on-one, I encourage folks to read labels. You want to be careful if a food has any hidden sources of sugar, because those sugars, again, are going to impact our carbohydrate intake and also impact our blood sugar levels very, very rapidly. All right. So I mentioned in the introduction the Mediterranean diet. There's actually been a lot of research about the Mediterranean diet, and it seems to be the probably the healthiest overall diet plan or whatever that is best for improving blood sugar control. There's lots of benefits, but the Mediterranean diet is primarily plant-based eating pattern with obviously lots of vegetables, lots of fruits, lots of beans, whole grains, nuts, seeds, some fish and poultry, and a low intake of red or processed meats. Minimal amounts of added sugars or refined foods. So you can see in this plate, I think that's a little piece of bread, but other than that, everything on that plate is very natural and found in nature in the form that it is seen on this plate. And also in the Mediterranean diet, olive oil is used as the primary fat. So again, I mentioned before that the Mediterranean diet has been studied in quite a bit and studied specifically on its impact for type 2 diabetes. And it's led to much lower or significantly lower blood sugar levels and significantly lower hemoglobin A1C levels in the blood. What that is a 3-month average of what your blood sugar is. So the hemoglobin A1C is a very good measure to know really what your blood sugar is doing over the course of time. All right, so Strategies to monitor your blood sugar. Okay, so I've got a picture here of a CGM, which is continuous glucose monitoring. This is kind of the gold star of of how to test your or know what your blood sugar is doing. You can see on the person's arm, there's just kind of a little device there, but inside there's like a little teeny tiny little probe that can go into your skin and it stays there for a while. And that probe, that device on your arm can then talk to, I think this is just like a dedicated glucose monitor, but there are also apps that you can download to your phone, and it will give you, as the name implies, continuous measurements of your blood sugar. And that is strongly recommended as a frontline tool for many individuals with diabetes. You can know what your blood sugar is doing at any moment in time. The devices also can be programmed to provide alarms if your blood sugar gets too high or if it gets too low. This is really key for people who are using insulin in their diabetes management, or for anyone who wants to be more diligent in their glucose monitoring. Another strategy is using self-monitoring with a finger stick. You may have heard of this. People will have a special glucometer. You take a drop of blood, like a quick pinprick. You get a drop of blood, you put it on a test strip kind of, and then you put that test strip into the reader, the device, and then it will tell you within a few seconds what the blood sugar is at that one very moment. Obviously, it requires a lot of pricks, but this can be used pretty well for some people. Some people will just use that to measure before meals what their blood sugar is doing, maybe right at bedtime, or maybe right when they first wake in the morning. And then we just encourage like additional monitoring of glucose if you're sick, because we know that stress and illness and infection can affect glucose levels more so. If you're having any treatment changes, for example, if you had any new medication changes with your regimen, it's important to have more monitoring of your blood sugar at those times. All right, so just real quick, what do you do if your blood sugar goes low? So first of all, you should know what it feels like. Anyone with diabetes should know what it feels like. And early symptoms include shakiness, sweating, confusion, kind of being irritable or dizzy. And it's really important to have very quick recognition in order to treat. The 15-15 rule is giving someone 15 grams of fast-acting carbohydrate. So an example would be like 4 ounces of orange juice. Give them the 15 grams of fast-acting carbohydrate, then wait 15 minutes, and at that point recheck blood sugar to see where the blood sugar is landing there. Someone might need to follow up with a balanced snack with some protein and carbohydrates so that blood sugar then stays level. And then also you want to avoid this as much as possible. And we do that with consistent meal timing, monitoring our blood sugar, and adjusting intake if you are exercising or more active. Now, what about the opposite? What if your blood sugar is too high? This arises from things like a lot of stress, eating a lot of carbohydrate at one time. And we want to make sure that nutrition management, we're doing all the things we need to do there to prevent those spikes in high levels of blood sugar. Choosing foods that are not going to affect the blood sugar so much. So everything we've already talked about, those high fiber foods, pairing carbohydrate containing foods with a protein and healthy fat to help even out those blood sugars and prevent those blood sugar spikes from going too high. And if you're someone who's having lots of events where your blood sugar goes too high, it's important to kind of reassess, reevaluate. Maybe your medication management needs to change, as well as take a closer look at what you're doing nutrition wise. And I'm not going to go into too much detail here, but there are obviously other strategies to manage diabetes besides through nutrition. And medication management for diabetes consists of several different drug classes that target different mechanisms for improving either insulin sensitivity or increasing insulin supply, reducing glucose absorption, all of these kind of strategies. Okay, so probably the most common that you've heard of is metformin. That's really kind of the recommended initial medication strategy for most adults with type 2 diabetes because it is effective, low cost, and we have metformin's been around for so long. We've got a lot of data on it, and it's a very safe medication to use as kind of a frontline strategy when you're diagnosed with diabetes. Now, more and more, I've got a picture here of Wegovy, which is a GLP-1 receptor agonist. This is this is becoming more and more common, and we're seeing lots of studies that show very, very strong improvement in blood sugar control. Also helps promote weight loss, which we know that if we experience weight loss, there's less of that fatty tissue that's causing the inflammatory state in individuals with diabetes. That's also resulting in the insulin resistant. So it helps kind of on two fronts, the weight management side, but also the blood sugar control piece. There's dual receptor agonists. So there are things that like tirzepatide and Mounjaro are probably the most common. Maybe those are the only ones that I know of that are have combined the GLP-1 that Wegovy is, but also has an additional medication in there that is GIP, which is another hormone that is involved in this process. So they're finding that there's powerful glucose lowering properties and significant weight reduction, and probably even, I think the data shows that it's even more effective than just the regular GLP-1 that Wegovy. And then obviously there's insulin therapy, and you can have that you can get like a regular amount of insulin daily at certain times, or you can have insulin prior to meals, depending on how much of a meal or how much carbohydrate you're going to be eating. These are all things that you work out with your endocrinologist, and it's more in depth. There's a lot more to it than just what I'm going through today. And then I just wanted to kind of wrap up by saying, really, it's important to find the balance for you that works. And there's really no good or bad foods. I think there's always a way to include your favorite foods but you have to kind of make strategies and figure out how, if you're going to have your piece of chocolate cake, how is it that you're going to adjust your diet so that you can still maintain your blood sugar at a healthy pace, at a healthy place, I should say. And I just want to finally say that you can, if you have additional questions, certainly any dietitian can help you and is probably a critical person that should be involved in the management of diabetes, as well as your primary care doctor and an endocrinologist. Any other specific questions? can be directed here at the nutrition department here at Kennedy Krieger. The number is listed on the screen. And I've also linked, I don't know if it will work in this presentation, but hopefully, if not, you can find the nutrition department by searching for Kennedy Krieger Nutrition. Thank you for having me today, and that's all I have for now.